How did you pick your Medicare plan? Most people focus on the premium or the perks. But the real difference isn't the monthly cost. It's what happens when you get sick. The problem isn't the coverage today. It's that once you are enrolled in a Medicare Advantage plan, switching back to original Medicare with full protection can become impossible if you are already ill. That's the trap most people never see coming. For over 65 million Americans on Medicare, this is not a hypothetical. It's the single most important financial decision of retirement: original Medicare versus Medicare Advantage. The brochures promise freedom, but the fine print hides a one-way door. And that door slams shut exactly when you need it open most. Every single day, over 10,000 Americans turn 65 and face this exact choice. It seems simple: pick the government-run original Medicare, or go with a private Medicare Advantage plan that often costs less and throws in dental and vision. Nearly 33 million people are now in Advantage plans, and the marketing is everywhere. $0 premiums, gym memberships, even grocery allowances. Who wouldn't want more? But here is the thing: those extra benefits are not free. They come with a different set of rules. Rules most people never read until they're already deep in the system. The first rule is how you get care. Original Medicare lets you walk into any hospital, see any doctor in the country who accepts patients. Medicare Advantage, however, puts you inside a network. Step outside that network, and your costs can jump without warning. And that's just the beginning. The second, far uglier rule is something called prior authorization. That means your Advantage plan can decide, before you ever step foot in a treatment room, whether that procedure is necessary. In 2024, about 1 in every 13 prior authorization requests was denied. That's millions of people told no for a test, a surgery, a specialist visit. And here is where it gets twisted. 81% of those who appealed actually won. But only 1 in 10 people ever filed an appeal. The others just gave up and paid or went without care. Yet none of that is the trap. The trap is what happens when you realize you made a mistake. Maybe your condition gets complicated. Maybe you need a cancer center across state lines. You tried to switch back to original Medicare with a supplemental Medigap plan for full protection. And that is when you discover the door you walked through only opened one way. Because switching plans is not the hard part. Surviving the medical questionnaire that follows is. When you turn 65 and enroll in Medicare Part B for the first time, you are handed a golden ticket. It's called the Medigap Open Enrollment Period. For exactly 6 months, any insurance company must sell you a supplement plan regardless of your health history. Cancer survivor? Doesn't matter. Heart condition? Covered. You cannot be denied, and you cannot be charged more. This is the only truly guaranteed moment to get full protection in the Medicare system. And once it's gone, it's gone. Now, if you choose a Medicare Advantage plan during that same window, the government gives you a safety net, a 12-month trial right. If you don't like the Advantage plan, you can drop it within the first year and return to original Medicare with guaranteed issue for a Medigap policy. This is your last exit ramp. After month 13, the door locks. Let that sink in. If you are in a Medicare Advantage plan for more than 1 year and then develop a serious condition, there is no automatic path back. You can switch plans during the annual election period in the fall or the Medicare Advantage open enrollment from January through March, but moving back to original Medicare is only half the battle. The real fight is getting a Medigap policy to cover the 20% coinsurance that original Medicare leaves behind. And in 47 states, insurers can reject you, charge you triple the standard rate, or exclude coverage for your pre-existing conditions for up to 6 months. This is not a loophole. This is the core design. Imagine you are 72 years old. You've been in an Advantage plan for 7 years because the $0 premium and dental coverage looked great. Then you are diagnosed with stage 3 lung cancer. Your oncologist recommends a specialized treatment center in another state. But your Advantage network requires you to stay local, and the prior authorization for the out-of-state referral is denied. You decide to switch back to original Medicare so you can go anywhere. You file the paperwork during the next open window in October, effective January 1st. Then you apply for a Medigap plan. The underwriter reviews your application, sees lung cancer, and issues a denial letter. Now you have Original Medicare with no supplement, facing unlimited 20% coinsurance for chemotherapy, radiation, and hospital stays. You are clinically free to see any doctor, but financially trapped in a disaster. This scenario plays out thousands of times every year. A former commissioner on the Medicare Payment Advisory Commission, the body that advises Congress on these programs, called the inability to switch easily a real concern in our system. Yet it persists. The marketing materials for Advantage plans highlight the gym memberships and the low premiums, but they never mention that you are trading long-term flexibility for short-term perks. The trade only becomes visible when you are sick, and by then it's often too late. There are only 3 states, Connecticut, Massachusetts, and New York, that allow you to buy a Medigap policy year-round without medical underwriting. If you live anywhere else, you are subject to the health screening. And the screening is where the trap tightens. Insurers look for conditions that will cost them money: congestive heart failure, diabetes with complications, chronic obstructive pulmonary disease, dementia, or recent strokes. If you have any of these, they can say no. They can also impose a waiting period of up to 6 months for treatment of those pre-existing conditions, even if they do accept you. That means you pay premiums but get no coverage for the very illness that drove you to switch. Meanwhile, inside the Advantage plan, the prior authorization machine keeps turning. A 2022 report from the Department of Health and Human Services found that 13% of denials in Medicare Advantage were for services that would have been approved under traditional Medicare. That's roughly 1 in 8 people who got a no that should have been a yes. If you push back, you have a good chance of winning on appeal, but the process is exhausting, especially when you are battling a disease. Most people just absorb the cost or forego the treatment, and the plan saves money. The asymmetry is brutal. The healthy get rewarded with extra benefits, while the sick get locked into a system that limits their choices. And the sickest among them discover that the exit door doesn't just have a narrow window. It has a guard who can turn them away based on the very condition they are trying to treat. What began as a simple choice between 2 cards becomes a lifetime contract written in invisible ink. And that ink only appears when your health fails. Here is where it gets even more insidious. The sick people trapped in Advantage plans are not a glitch. They are a feature. Medicare pays private insurance companies a fixed monthly amount per enrollee, and the healthier the pool, the more profit the insurer keeps. The sicker you are, the less profitable you become. So when a plan denies your out-of-state cancer treatment or forces you through weeks of paperwork for a simple MRI, it is not just bureaucracy. It is financial engineering. Your delay is their margin. And every person who leaves for Original Medicare is one less subsidizing the bottom line. That is why the exit ramp is guarded so fiercely. Meanwhile, the clock is ticking not just on you, but on the entire system. Today, over half of all Medicare beneficiaries are in Advantage plans, up from just 19% in 2007. At current growth rates, that number will hit 60% by the end of the decade. But the Medigap rulebook has not changed. Tens of millions of people are streaming through a door that locks behind them, with no guarantee they can ever return with full protection. The window of escape keeps shrinking as more people pass the 12-month trial right without knowing it existed. By the time their health turns, they have been in the plan for years, and the medical questionnaire will expose every condition Medicare was supposed to shield them from. Now consider the numbers if you manage to switch. The average Medigap plan G premium in 2025 runs about $150 to $200 per month if you enroll when healthy. But if you go through medical underwriting after a cancer diagnosis, that same policy can cost over $400 a month, sometimes much more. And that's if you even get an offer. Many insurers simply deny. So you are left with Original Medicare and no cap on your 20% coinsurance. A single hospital stay for a major illness can hit the maximum Advantage out-of-pocket limit of $9,250 in a few days. In Original Medicare with no supplement, your 20% share of a $200,000 bill is $40,000. And there is no ceiling. Repeat that a few times, and you can see how medical bankruptcy becomes a retirement risk. The worst part? This is not hidden in some dark corner of a government vault. It is written in plain Medicare rules and updated every year. But the sales presentation never mentions it. The television ads with smiling retirees doing yoga never show the guy who needs a heart bypass and can't get out of his network, or the woman denied a Medigap policy because her diabetes required insulin. The marketing is a one-way fantasy, and yet a small number of people do escape. They discover the narrow windows, the special enrollment periods triggered by very specific life events, like moving out of a plan's service area or losing an employer group plan. Or they live in one of those 3 states where insurers can't turn you away. Or they enrolled in Medicare Advantage for the very first time and are still within the 12-month trial right. That trial right is the single most powerful tool almost no one uses, because to use it, you have to know it exists. And by month 13, the knowledge arrives too late. But here is the truth that changes everything. You don't have to stay trapped. There is a sequence of decisions and a timeline that can protect you, whether you are healthy now or already staring down a diagnosis. But it requires one thing most people never do: planning your exit before you ever need it. The escape route exists, but it only works if you follow a sequence so specific that missing a single step can cost you tens of thousands of dollars. It begins with the calendar, and it begins before you are sick. First, the most powerful tool in your hands: the Medigap open enrollment period. That 6-month window the moment you turn 65 and enroll in Part B is sacred. During those months, you can walk into any insurance office and buy the strongest Medigap plan available without a single health question. It doesn't matter if you have a family history of heart disease or a knee replacement on the books. You are guaranteed, and you lock in the lowest rate you will ever get. This is not an enrollment period you want to trade for a gym membership. If you are reasonably healthy, this is the door you secure first, even if you end up choosing Advantage later. Because once it passes, it never returns. Second, if you decide to try Medicare Advantage, treat it like a lease with a hard deadline. The 12-month trial right is your eject button. Mark the date you started the plan. Before month 12 ends, you must decide if the network works, if your doctors are still in it, and if you trust the prior authorization process. If any doubt creeps in, pull the trigger and switch back to original Medicare. You will have guaranteed issue for Medigap, meaning no underwriting, no denial. The worst mistake people make is thinking they can wait and see. After month 13, the door changes. You can still switch back to original Medicare, but now you face the medical screen. For most people, that screen is a wall, not a filter. Third, if you are already past the trial right and inside an Advantage plan, you still have windows. The annual election period between October 15th and December 7th, and the Medicare Advantage open enrollment between January 1st and March 31st. During those periods, you can switch back to original Medicare, but you will likely need a Medigap policy. So your exit plan must account for the medical underwriting hurdle. This is where you need to know your state's rules. If you live in Connecticut, Massachusetts, or New York, you have year-round guaranteed issue protection. You can switch back at any time and get a supplement. Otherwise, you must be strategic. Some life events trigger a special guaranteed issue, right? If your Advantage plan leaves your area, if you move outside the plan's service area, or if you lose employer coverage. These are narrow, but they exist, and they bypass underwriting entirely. That brings us to the final surprise, the move that can save you. If you are trapped in an Advantage plan and facing medical underwriting, relocating out of your plan's service area triggers a guaranteed issue period for Medigap. It doesn't require you to sell your house and flee the state. Simply moving to a different county where your current plan no longer operates can be enough. It is the nuclear option, but for someone facing a catastrophic illness with denied coverage, it can be the difference between bankruptcy and survival. And almost no one is told this. The entire system is built on a sequence. You don't get to reorder the steps. First, you protect your Medigap, right? Then, you evaluate Advantage. Then you respect the trial deadline. And if you are past that, you learn the escape hatches. The easy in, hard out warning on the thumbnail wasn't a slogan. It is the financial reality of Medicare. And those who ignore it pay for it not in monthly premiums, but in the years they spend fighting denials while the bills pile up. The Medicare system was designed to protect people in their most vulnerable years. But the gap between that promise and the paperwork is where life savings disappear. The choice between original Medicare and Medicare Advantage is not just about premiums or dental cleanings. It is a bet on your future health, and the house almost always wins when you don't know the rules. The question isn't whether you can get in, it's whether you can get out when it matters most. If this made sense to you, hit the like button and subscribe so you never miss a breakdown that could save you real money. And if you want a step-by-step guide to securing your Medigap protection or navigating your trial right, I've put a special offer together for you. The link is in the first pinned comment below. Take control of your options while the window is still open.